Welcome to today's video focusing on the symptoms of pancreatic cancer. Many of the most dangerous illnesses slip by unnoticed until intervention is no longer simple, and minor issues like back discomfort, exhaustion, or a vague sense that something is wrong are often dismissed even within clinics. Here is the reality: pancreatic cancer ranks among the most aggressive and quietest diseases. At the point of diagnosis, nearly 80% of cases have already reached advanced stages. Worldwide, more than 495,000 people receive this diagnosis each year, and it accounts for over 466,000 deaths, according to the World Health Organization, which is close to one life lost every minute. There are genuine early signals identified in research that frequently get missed or misread, and that is what we will cover today. This video lays out 15 symptoms of pancreatic cancer, each supported by medical studies and expert-reviewed journals. Some signs may be unexpected, while others may prompt careful reflection. Pay close attention to symptom number 14, because it is one of the most overlooked clues with the potential to change the outlook through earlier detection. Our goal is not to alarm you. Our aim is to equip you with knowledge. Recognizing these signs sooner improves the chances of survival. Stay with us through the final moments, because we will also explain what recent studies reveal about who faces the highest risk and what practical steps can help you stay ahead. If you care about taking control of your health, tap like and subscribe. We share science-backed health content every week and would love to welcome you to this community. Tell us your country in the comments so we can see where you are watching from. Let's begin, because the insight you gain today could truly save a life. This video provides information only and does not replace medical advice. All research has been verified and references appear in the description. All right, let's start with what to watch for beginning with symptom number 1. 1. General malaise. A lingering sense of being unwell without a clear explanation. The vague fatigue and discomfort doctors call malaise can seem trivial, yet for some, it is an early signal of something more serious. A nationwide Danish analysis encompassing more than 25,000 pancreatic cancer cases found that general malaise and fatigue were frequently recorded after diagnosis, noted explicitly in clinical documentation, underscoring how common these symptoms are among patients. In separate large-scale research from the United Kingdom, individuals who presented with malaise were 2.4 times more likely to receive a pancreatic cancer diagnosis than those without this complaint, highlighting its potential diagnostic relevance. Malaise is nonspecific and often stems from benign causes, but when it persists, particularly in adults over 60, it warrants medical attention. Because pancreatic cancer is difficult to detect, early noticing subtle ongoing changes like prolonged malaise can matter. If you have been unusually tired or feeling unwell without an obvious reason, arrange an evaluation with a healthcare professional. Early assessment and intervention can improve outcomes. 2. Fatigue. In pancreatic cancer, fatigue goes far beyond ordinary tiredness. It is a persistent, crushing depletion of energy that does not lift with sleep and steadily interferes with daily functioning. At a Northern Italian oncology center, 94% of patients receiving chemotherapy for pancreatic cancer reported this symptom, underscoring how widespread and burdensome it is in this population. The intensity is not evenly distributed. Older adults and women described higher levels of fatigue, and it was more pronounced in the presence of anemia, marked weight loss, or smoking. Multiple mechanisms contribute to this exhaustion. The tumor itself can drive systemic inflammation that disrupts normal physiology, while treatments such as chemotherapy may aggravate the problem by damaging healthy cells and precipitating complications like anemia. Because of its impact on well-being and treatment tolerance, addressing fatigue is essential. Helpful strategies include evaluating and correcting anemia, improving nutritional intake, and introducing appropriately paced physical activity as tolerated. Clinicians should routinely assess fatigue and implement targeted measures to relieve it, with the goal of preserving quality of life throughout care. 3. Fever. A persistent low-grade fever can at times be an early clue to pancreatic cancer, even when no other symptoms are present. In uncommon situations, the body mounts an immune response to the tumor in the absence of infection, producing what is known as neoplastic fever. One documented case involved a person with pancreatic adenocarcinoma whose primary complaint was fever. After surgical removal of the tumor, the fever resolved completely within 4 days and did not recur during a 39-month follow-up, pointing to a direct link between the malignancy and the febrile response. Population data echo this pattern. A large study of Danish health records identified fever among the significant symptoms reported in the 5 years preceding a diagnosis of pancreatic cancer. While not common, fever can therefore be part of the broader symptom profile. If you are experiencing unexplained persistent fevers, particularly alongside weight loss or fatigue, seek prompt evaluation by a healthcare professional for itchy skin. In the context of pancreatic cancer, persistent itching is often more than a simple dermatologic complaint. It can reflect a deeper problem. When tumors obstruct the bile ducts, cholestasis develops, and bile acids, along with other substances, accumulate in the body. These circulating irritants stimulate nerve endings, producing a relentless itch that can be difficult to ignore. Recent research clarifies why this occurs. A 2025 review highlighted the central role of the enzyme autotaxin, which elevates levels of lysophosphatidic acid, a signaling molecule that activates itch-specific nerve fibers. Because this pathway is not primarily histamine-driven, standard antihistamines frequently provide little relief. Therapies that target the underlying mechanism tend to help more. Approaches that reduce bile acid buildup or diminish autotaxin activity, such as bile duct decompression or inhibitors directed at the enzyme, have shown greater promise in easing symptoms. Recognizing the connection between biliary obstruction, autotaxin signaling, and pruritus is crucial, since addressing the root cause can substantially improve a patient's quality of life. 5. Blood clots. Sometimes, the earliest clue to pancreatic cancer isn't digestive at all. It's an unexpected blood clot. This phenomenon, known as Trousseau syndrome, involves clots forming in unusual locations, such as the arms or the chest wall, often recurring or appearing in new sites. The underlying cancer drives a hypercoagulable state, making the blood more likely to clot than normal. Data support its role as an early warning sign. A 2024 study in Cancer Medicine evaluated 4,086 people with pancreatic cancer and found that 2% of those receiving palliative care experienced venous thromboembolism within the year before their cancer was diagnosed. In other words, VTEL can precede recognition of the disease and is also linked to poorer survival, underscoring its clinical importance. If you or someone you know develops an unexplained clot, especially without typical risk factors, seek medical attention promptly. Early identification of pancreatic cancer can meaningfully influence treatment choices and outcomes. 6. Sudden onset diabetes. When diabetes appears after age 50, it is usually classified as type 2. In uncommon instances, however, a brand new diabetes diagnosis can be an early signal of pancreatic cancer. Tumors that involve the pancreas may impair insulin production, pushing blood glucose levels higher. Studies estimate that about 0.8% of people over 50 with newly diagnosed diabetes harbor underlying pancreatic cancer, a risk notably above that of the general population. In addition, roughly 25% of individuals with pancreatic cancer received a diabetes diagnosis within the 3 years preceding their cancer diagnosis, suggesting that in some cases the tumor triggers diabetes rather than diabetes predisposing to the cancer. If you were recently diagnosed with diabetes after 50 and are noticing unexplained weight loss or other concerning symptoms, speak with your healthcare provider. Detecting pancreatic cancer early can substantially improve treatment outcomes. 7. Pale or grayish skin. When a bile duct becomes obstructed, bilirubin accumulates in the bloodstream. As levels rise, this pigment deposits in the skin, producing a yellow tint known as jaundice. In some people, especially those with lighter complexions, this may read as a pale or grayish cast. This color change is often among the earliest visible signs of pancreatic cancer, particularly when a tumor sits in the head of the pancreas. Evidence backs this pattern. A study in clinical gastroenterology and hepatology reported that jaundice and other features of bile duct blockage, such as pale stools and dark urine, were common in pancreatic cancer, and appeared more frequently in patients than in control groups. Noticing a sudden shift in skin tone to yellow or pale gray warrants prompt medical evaluation. Early recognition and diagnosis can significantly improve treatment outcomes. 8. Muscle wasting in pancreatic cancer. This is not a matter of dropping a few pounds. It is a profound involuntary loss of body weight that targets your muscles, bringing weakness and fatigue. What makes it especially concerning is that this decline in muscle mass can begin before a formal diagnosis. Research published in Nature Communications in 2023 showed that skeletal muscle loss was detectable up to 18 months ahead of a pancreatic cancer diagnosis, suggesting that muscle wasting may serve as an early signal rather than simply a later complication. Why does it occur? Pancreatic tumors release factors that derail normal metabolism. One of these is the pancreatic adenocarcinoma upregulated factor, or PARF. Studies indicate that PARF can directly trigger the breakdown of muscle cells, leading to atrophy. The consequences go beyond feeling weak. In people with pancreatic cancer, loss of muscle is linked to poorer outcomes and shorter survival, affecting quality of life and the effectiveness of treatment. Recognizing this connection underscores the need for early detection and comprehensive care. If you or someone you know is experiencing unexplained weight loss or new muscle weakness, seek guidance from a healthcare professional. 9. Constipation. When pancreatic function is impaired by cancer, normal digestion can be disrupted. This disruption may slow the movement of food through the intestines, producing stools that are harder, drier, and more difficult to pass. Medications used for cancer pain, particularly opioids, can further depress gut motility and make the problem worse. Emerging evidence points to a broader connection. A 2024 study in Frontiers in Oncology using Mendelian randomization reported a potential causal link between constipation and a higher risk of pancreatic cancer, with an odds ratio of 1.56. This suggests that persistent constipation may not only reflect disease-related changes, but could also be associated with the development of pancreatic cancer. If constipation is ongoing, especially alongside other symptoms such as abdominal discomfort or unexplained weight loss, seek evaluation from a healthcare professional. Early detection and timely intervention can make a meaningful difference. 11. Diarrhea. When the pancreas isn't functioning properly, digestion can be thrown off in a major way. One telltale result is frequent hard-to-control loose stools. Under normal circumstances, the pancreas releases enzymes that break down fats, proteins, and carbohydrates. If a tumor blocks these enzymes from reaching the intestines, nutrient absorption falters. Food then moves through the gut too quickly, resulting in diarrhea. Evidence shows this symptom can be a crucial clue. The American Journal of Gastroenterology documented a case in which persistent diarrhea was the only sign that led to a pancreatic cancer diagnosis. The patient had none of the classic features, like jaundice or weight loss. This illustrates how easily overlooked diarrhea can signal something serious. If these symptoms continue, consult a healthcare professional. Catching pancreatic problems early can make a meaningful difference in outcomes. 12. Indigestion. Indigestion often feels trivial, but when it persists or worsens, it can point to a deeper problem. In pancreatic cancer, a growing tumor may compress the stomach or the first portion of the small intestine, disrupting normal digestive flow. Food can linger in the stomach longer than it should, producing post-meal bloating, nausea, or a burning discomfort. Evidence links this symptom to increased risk. Research in BMJ Open reported that people who experienced indigestion without accompanying heartburn had a 3.8-fold higher likelihood of developing pancreatic cancer compared with those without these symptoms. That association underscores why chronic unexplained dyspepsia deserves attention. Take note if indigestion doesn't improve with usual remedies or appears alongside other red flags, such as unintentional weight loss. Because pancreatic cancer can be difficult to detect early due to subtle presentations, staying alert to changes in your digestive health can make a meaningful difference. 13. Bloating. That nagging swollen feeling in your belly after a meal is common, but when it lingers, it can point to something more serious. In a comprehensive investigation from the San Francisco Bay Area, researchers reported that 25% of people with pancreatic cancer experienced unusual bloating compared with only 2% of individuals without the disease. This corresponded to an odds ratio of 20, highlighting a markedly higher likelihood of bloating among those with pancreatic cancer. Why does this happen? The pancreas is essential for digestion because it produces enzymes that help break down food. When a tumor disrupts this process, digestive function can falter, allowing food to sit in the stomach longer than normal. That delay in gastric emptying can lead to persistent fullness and abdominal distension. If you are dealing with ongoing bloating without an obvious explanation, consult a healthcare professional. It may be nothing serious, but taking a proactive approach to your health is always wise. 14. Loss of appetite. Picture sitting down to your favorite dish and feeling queasy at the thought of taking a bite. For many people with pancreatic cancer, that's not a passing off day, but a persistent reality. The pancreas is central to digestion-releasing enzymes that help break down fats, proteins, and carbohydrates. When cancer disrupts this function, enzyme output can fall, and malabsorption follows. With nutrients no longer absorbed, efficiently meals can start to feel futile, as if eating isn't doing any good. There's another layer too. Pancreatic tumors can secrete factors that interfere with appetite control, scrambling the brain's signaling, so you feel full despite having eaten little or nothing. It's as if normal hunger cues have been overridden. Evidence underscores how common and consequential this is. A 2019 study in The Oncologist reported that up to 85% of people with pancreatic cancer experience significant weight loss, often driven by reduced appetite and the effects of malabsorption. In other words, this isn't simply a loss of interest in food. It reflects a complex interaction between the tumor, the digestive system, and the neural pathways that regulate appetite. If you or someone you know is dealing with ongoing loss of appetite, especially when it comes to weight loss or fatigue, seek evaluation from a qualified healthcare professional. Acting early can make a meaningful difference. 15. Abdominal pain. Discomfort in the upper abdomen that spreads to the back is a frequent presentation in pancreatic cancer. The ache often intensifies after meals or while lying flat and may ease when you lean forward. This pattern reflects how a growing tumor can compress or infiltrate nearby nerves and organ, creating a deep, gnawing sensation. Evidence supports this mechanism. A 2001 investigation in the Journal of Gastrointestinal Surgery found that patients whose tumors invaded the anterior pancreatic capsule and intrapancreatic nerves reported more pronounced abdominal pain. The study also linked greater pain severity to larger tumor size and the presence of lymph node metastasis. Prognosis tracked with symptom intensity. Individuals without pain had a median survival of 29 months, whereas those experiencing severe pain had a median survival of 9 months, underscoring the prognostic value of pain intensity in pancreatic cancer. If abdominal pain persists, especially when accompanied by other red flags such as unintended weight loss or jaundice, seek a comprehensive medical evaluation from a qualified health professional. Pancreatic cancer may be a silent enemy, but you are not powerless. When you listen to your body, take persistent symptoms seriously, and seek medical care early, you give yourself the best chance for timely diagnosis and effective treatment. If you or someone you love has noticed the warning signs we covered, don't wait. Speak with a healthcare professional and get evaluated. If this video helped you, please like it, subscribe to the channel, and turn on notifications so you never miss our weekly science-backed health updates. Share this with a friend or family member who might benefit, and tell us in the comments where you're watching from. Your support helps spread reliable information, and it might even save a life.